Hi and welcome. I'm Steve Martorano and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Hi everybody, welcome again to the Behavioral Corner, the podcast about everything. That's what I call it because, after all, everything affects our behavioral health. My name is Steve Martorano, host and guide. We are now a couple of weeks, second week into a brand new year. This will be our fifth year of doing the podcast in the Behavioral Corner, made possible by our underwriting partners, Retreat Behavioral Health. You'll hear more about them later. And so if you're just finding us, welcome aboard. We handle, as I said, a lot of topics that have to do with many things, not least of which is drug and alcohol disorders and the treatment of them, and also the wider range of behavioral health and mental health issues. And we're going to take a look at the mental health aspect today on the podcast. And we welcome to the corner for the first time our guest on this fascinating topic. Laura Riordan is our guest. Laura is not a healthcare professional. She's quick to point that out. But she has been a long-time sufferer and someone who is managing her bipolar and depressive disorder. She's a mom. She has a brood of kids running around the house. She has a loving and healthy relationship that she lives in and nurtures. And she's a full-time working woman. So she's got her full life, and is here to tell us about not so much the clinical aspect of bipolar disorder, which we spent a lot of time here talking about, but something that I've been interested in a little bit of. Are there support groups, not unlike AA meetings, for people suffering from something like bipolar disorder? Turns out there are, and they are numerous and well thought of. Laura is associated with one national organization, DBSA, that stands for Depression Bipolar Support Alliance. As I said, they're a national organization. I think they've been around for 30 years at this point.
Yeah,
she's affiliated, Laura's affiliated with the Delaware County, which is suburban Philadelphia chapter. We welcome her to the program. That's long-winded. I apologize. Laura, nice to meet you. Thanks for joining us.
nice to see your face after
That's
a
right.
little chat before we prepped. Yeah.
We talked a little earlier. Nice to see you as well.
And it's Laura Riordan, so it's the Irish
I'm sorry.
and
Riordan.
the Irish. It's okay.
The Irish did. Okay, I'll get it. Riordan.
Yep, you got it. In
so
Ireland, it's kind of like Riordan, but we just go Riordan. Yeah.
You're not gonna hold me to that, are you?
No.
Okay.
I have a niece, Saoirse, and it goes Saoirse. It's like every vowel except you.
What's that actress's name? The one that has a very
It is Saoirse. There's a Saoirse.
That is her. Yeah, I thought so.
Yeah.
I'll never get to pronounce that correct. Anyway, I'll get Riordan from now on. So tell me, let's talk about, you were diagnosed with bipolar and depression disorder probably about 20 years ago, if I remember what I read. I'm guessing though, but I'm guessing that you know something was wrong and you suffered from certain symptoms well before you were diagnosed. Is that right?
Well, I should have known something was wrong, but it was just my life, so I didn't really realize. But I had symptoms as early as probably 1 and 2 years old of depression. There was some trauma and things in my childhood, as well as genetic predisposition on both sides of my family for bipolar and depression. So I never was diagnosed in any way. Senior year, I had of high school, I had some stressors, trying to pick colleges. I was valedictorian. I had bags and bags of mail from all these different colleges that my mom was trying to help me sort through. I was having a tough time in a relationship at the time, and did really well on my SATs. So that was part of the bags of college mail, and just trying to decide, applying to all these different schools and what would be the best route to go to graduate with the least amount of loans. And I was also attending college while attending high school. There was a program with my local my Catholic high school and the local colleges. So I got to go to Villanova 2 classes a semester senior year. So 4 total classes in addition to my high school classes. So there was a lot going on. I was stressed, but I saw a counselor that my mom knew just once or twice. I took like 1 or 2 days off of school just because it was overwhelmed, but they called it just stress, not and it probably was pretty severe depression, anxiety, but they never diagnosed that. So I almost am glad I didn't get diagnosed because until later, because I was valedictorian, I wasn't dealing with meds, I wasn't dealing with a diagnosis or the stigma of any of that. But looking back, I had severe depression. I would hide in closets to see if anybody would find me because I didn't think they cared. So maybe if I hid in a closet, I'd see how long I could wait there and hide. And very sad, very challenging childhood, a lot of bullying. Nobody really got me, like,
Yeah,
and this isn't even bipolar, this was me, but like, hey, you want to play Barbies? And I was like, do you think there's life on other planets? What do you think happens after we die? And this was like, 4 to 8 years old. I just didn't really fit in at all. So,
Let,
a
let,
lot of
but then I think you said in your bio around 2003, you were sort of diagnosed with this
2000.
disorder. Can I don't want, I mean, we've had plenty of clinicians and experts on to talk about bipolar and how it's being treated in a number of different ways. We're not here to do that. We're here to talk about your support, what you've learned in what you call a roller coaster ride, which really does, it's the perfect metaphor for what a bipolar experience is like. Tremendous highs, manic conditions, and they are always followed by a precipitous plunge into dark and dangerous depression. So it's a real roller coaster ride. That's what we're going to talk about, and the support you now help people with and that you receive. But before we get started, what are the characteristics of bipolar depressive disorder?
Yep. And it was manic depressive. Even when I first got diagnosed, it was like manic depression / bipolar, and it switched to try and, I guess, get away from a stigma. Not that bipolar doesn't have stigma as well, but when I first got diagnosed, I had a very serious manic episode in college that was in that one story that I shared with you, and that was my first diagnosis, true diagnosis. Even though I had exhibited depression and hypomania throughout, again, childhood, and to study for a test, I would stay up all night, and I made myself hypomanic. Did great A's on everything, but I didn't know I was making myself hypomanic. I just thought I was a procrastinator, but that hypomania energy, actually, I excelled extremely in every class from kindergarten through college. But bipolar 1 tends to be, you've at least been hospitalized once for a severe mania. So not getting enough sleep, really rapid speech, rapid thoughts. It can start to get to a level of psychosis for some people. Some people get angry. I don't really tend to get angry. I tend to just get happier and happier. You make more and more connections. I don't know if you've ever seen Homeland, but they do a really good job with Carrie, who's a CIA agent, describing how she can make these connections when she's manic that other people aren't seeing. And that can happen. It's not just crazy. It's also things that people are missing. So things start happening that are good. I can make connections with people and with things and memories and everything really, really quickly. But then it gets too far if I'm not sleeping enough. So bipolar 1 is at least one mania, and then generally always depressions that have gone along with that, but very severe depressions. But bipolar 1 characteristic, at least one mania, generally hospitalized for it. Bipolar 2 is hypomanias and then depressions that are cyclic. There's also bipolar non-specified is another that's just kind of, they haven't quite determined exactly, but it seems to have the characteristics of the other bipolar 1 and 2. And then rapid cycling, sometimes bipolar rapid cycling, some people can have a hypomania and a depression and then back to a hypomania and depression all in a day or a few days time period. So that's rapid cycling as well. So those are the kind of 4 categories that are out there right now, but it's really extreme highs, extreme lows, and then stability in between.
Yeah, the stability is what you guys focus on in the support groups, how to manage this, because we're talking about a lifelong condition. There is, right as we speak, no cure for bipolar disorder. Let's talk about just briefly the manic episodes characteristic to bipolar 1. These are, you say, will lead to a hospitalization if they are severe enough. They can lead to all of the things you said: the rapid thinking, the speech patterns, lack of impulse control, I guess, is stuff I've read. Risk taking. It can be a very dangerous time. When you are in that manic episode, how can you characterize how possible is it possible for anybody to reach through that mania and say to you, Laura, you're having an episode? This, did anybody ever get through to you during a manic episode like that?
Absolutely. And hypomanias, I've had countless, where it's the first 2 to 3 days I really have to keep an eye on if I'm not sleeping well. I'm just really happy. I'm excited. I'm planning 10 different things. I'm answering 50 different emails and 100 texts on my phone. And Chris is really supportive and understanding and starts to say, hey, you texted 50 people today. Like, we got to rein it in a little bit. And I saw you had like 27 Facebook notifications in an hour. So let's rein it in.
Chris is your husband.
My significant other.
Yeah. So it helps you have somebody around to go, whoa, during that hypo episode. But when you're into a deep,
keep it in check before the mania hits is the biggest thing. And my manias are a little bit different than many other people's. Every mania I've had has been incited by a medical condition. So my first one was after a knee surgery, another one was after a C-section, another one was after another knee injury, one was after a med change that actually caused mania, which is really scary when the meds they're supposed to be giving you to keep a mood stabilizer caused my one mania in 2004. The vaccine, I don't want to go too into vaccines of any sort, but the COVID vaccine in 2021 caused a mania. So all of my manias that became out of control for me were things that were, one was a very, very severe ankle injury. So when the injury impacts my sleep and also causes adrenaline to heal, because every injury I've also actually healed faster than doctors expected because I go into overdrive. So there's some people that have that. The only times I've been in uncontrollable mania that I wasn't able to keep the hypomania from growing into mania was these medical conditions that were out of my control. So it's frustrating because I've had some really major periods of stability with my coping strategies, with or without meds. But then if something major medically happens with me,
you got to be careful. Yeah. Let me ask you about, well, how often were you hospitalized as a result of bipolar?
8 times.
8 times over 20, almost 20
years.
Over 24 years. How long were you typically hospitalized?
Most depression, when people are in there, they're in 4 to 5 days and then they get booted. For manias, I've seen people get in for anywhere from 5 to 7 days, sometimes a few weeks. Some situations I've heard as extreme as, a year.
Yeah.
They're just not getting out of there. But mine, because they've been so severe and they're trying to get meds to get me reined in, and I'm still generally manic when I leave, that we're trying to at least, curbing back towards hypomania and then crashing. But usually anywhere from 2 to 3 weeks.
Yeah. And so, that sounds like an ordeal. It sure is. And it sounds like a lot of time in and out of hospitals. It's fairly common situation.
And I'll make a note that many of those have been followed if people don't know, and they're really beneficial. And you can even use those as preventative to inpatient. There's PHP programs, which is the partial hospitalization program. It's generally about 9 a.m. to 3 p.m., at least in this Philadelphia area. That you go every single day. You can even get a bus ride or a van ride there because they know people don't always have transportation. And then IOP is intensive outpatient. It's usually about 4 days a week for about 3 hours of the day. Sometimes they have day or even evening shifts if you're trying to work. And that can either be preventative care or post-hospital inpatient care, to help with the prevention of hospitalization or the transition into regular life again post-hospitalization.
Yeah, it's important to let people know, as difficult this disorder is, and many mental health disorders are, there's a lot of help out there, and a lot of help that is built around just what you described, the unique nature of this disorder, which has devastating effects on one's personal life and their career. Difficult to keep jobs under these circumstances. So it's good to know that there are levels of care that you can get. What you guys do at the Support Alliance is, it seems to me, I haven't seen one of the sessions yet. It seems to be not unlike what goes on at an AA meeting. And I mean that in the following way. They'll tell you, people who are in an AA, this is not a treatment. We're here to support one another. Tell us how that works for you. How do you support your fellow bipolar disorder folks?
Yep. And we always let people know I'm one of the primary numbers, and our president, and I'm the VP of the board. So we're the primary numbers. So when they reach out, so I always let people know, please know we are peers as well. We might be having a very hard day. We are not certified in any way. We are not, we are not doctors. We are not nurses. We are not psychiatrists. We're not therapists. And if you are a therapist or a doctor that's a peer, you do not come to the door with that. You come to the door as a peer or a supporter of someone in your life who's suffering with bipolar or depression. You leave every degree at the door. You do not come in as a practitioner. So you only come in as a peer or a supporter of someone who's suffering. But we do let them know that just upfront, hey, we have the resources we have, but we might be having a really tough day. And this is purely volunteer and purely peer support. So please know that this is the purpose of our organization. We're glad to provide lists of resources and recommend calling, your healthcare insurance provider to get ones that are covered by your insurance in the area. And we can say pros and cons, but we don't put out lists of who we would recommend for psychiatrists. But purely peer support. And just a quick review of how a lot of them are similar, but how ours go. We did do a lot of Zoom during COVID, obviously, so that helped people. I didn't do as much of the Zoom because I had a job that I was on like 12 Zooms a day, and then trying to jump on at 7:30 on a Zoom again. It was too much for me. But we're back to in person, which I'm very excited about. And before COVID, we would get up to 35 to 40 people on a Monday night for support in the Delaware County area. 7 to 9 p.m. we go. The first hour, everybody checks in and does a quick touch base. If you're new, you can wait till the end. But usually your first name, not full name, diagnosis, multiple diagnoses if you have them, which many people do. And generally a quick update of your last week or two since you hadn't been there. I often joke, hey, you don't have to tell us it's been 6 months since your last confession. Like, we don't care how long it's been, but that's always my little joke. And we do start with all of our guidelines. So we have these very specific guidelines for what to follow. We don't mention medication names because there can be a lot of negative connotation, but it might be exactly the medicine that helps the person next to you, even though it was awful for you. So we'll say mood stabilizer or atypical antipsychotic, or the categories, but not the brand.
Well, that's a great point. We should pause and make that very clear to people. I have seen and talked to bipolar people, and they will trade when it's personal. They'll go, did they give you this, or did they? And you're right. Administering those drugs, which, as I understand it, are crucial in helping someone maintain stability when they have bipolar. It is not an exact science. Your physician, your psychiatrist, is really trying to find what combination of drugs will work in conjunction with one another, so that you get some benefit from them. So it's good to see that you guys aren't in there going, here's a list of stuff you shouldn't use, or here's the stuff we recommend, because it's not that simple.
Yeah. We've also had guest speakers. So we have one gentleman who's been in the pharmaceutical psychiatric medication industry space that comes in and just does some training on dopamine, norepinephrine, all the neurotransmitters, and just what kind of those different categories of medicines, how they approach them. And one key note that a psychiatrist let me know, because I would always tell people bipolar, it's a chemical imbalance. It's not proven to be a chemical imbalance as of yet. They know that some of the medicines affect those chemicals like dopamine and norepinephrine and those things, but some people are actually leaning towards it being more of an inflammation-based issue. So omega-3s can be helpful because they help with inflammation and reducing inflammation. They don't know. So people keep mentioning mood, chemical imbalance, multiple doctors. And if you read up about it, Psychology Today, everything else, it's a myth or an unproven hypothesis. They still do not know. And they still have not been able to prove the genetic factors. Even I did a test, a research project at UPenn with myself and some other family members that have bipolar, but they still haven't been able to find what the genetic component is. They know there has to be because it runs in families rampant.
Yeah, but they haven't found
what it is.
Yeah, they haven't found the gene. Yeah, I know that. Well, it's this is the kind of stuff that someone who is battling a bipolar disorder and the corresponding depression needs to hear, because they keep taking drugs. The doctors are well intended. They don't seem to be working. And then a hopelessness begins to set in, where you begin to think, well, why even bother to try to maintain stability? It's only going to happen again. That's not necessarily true. You have had long, and you are right now in a long period of stability, right?
Yep. And I myself have actually been on over 30 medicines in various combinations over the last 24 years.
Yeah. Yeah.
Yeah.
You just have to find what combination of things work. And I know you guys in your support group talk about just that. There is a medical component. There are things you can do with the tools that you learn, and there's a support you get from family and groups like the Alliance. Let's talk a bit about coping. Let's talk about triggers.
Real
Yeah.
quick,
Yeah.
if I can, just for diving in, I said 7 to 8. We usually do that check-in, and then people who are new will talk. Then that second hour, what we really do is dive in. So if somebody's having a severe crisis, we dive in, we provide support. As facilitators, we're not meant to talk the whole time. We're meant to facilitate the conversation so that us and all the additional peers, if they have support for that person, to be able to provide their input and share the space. We don't want anybody overtaking the space.
Sure.
And we'll touch base with somebody. We're not taking the whole hour on someone. If there's a crisis, sometimes we'll have somebody step out with them to say, hey, if they're really upset, if they're angry, if they're anything, hey, we're going to have a few people that are available to step out with that person to the lobby and really give them some one-on-one attention. And then also, if nobody specific is having a crisis at that moment, we'll hear about some of the threads that go through other people. I'm having a hard time at work with a boss and peers understanding what I'm going through. I'm having a hard time with friendships or a significant other. I have a really hard time getting out of bed. So if we hear different things that are challenges at the time, we'll start to bring up, what's everybody use every day? What helps you do this? What helps you get through this? How do you approach it? And we just have gotten so many great ideas from each other over the years. Again, I started in 2003, so almost 21 years that I've been going, and have learned so much about bipolar, depression, anxiety, and about myself through those years. And I do have, so triggers we can talk about, and I did pull up that list of some of my strategies as well. So whatever you want to target.
Yeah, no, I want to hear strategies for sure. But in order to apply the strategies, you got to be aware of
triggers,
of triggers, right? So just for your triggers, you're pretty obvious. It has to do with your medical condition.
For
when
me,
your body
medical conditions, that don't allow me to sleep and also can drive adrenaline to heal. So those tend to be really what uncontrollable mania. But hypomania can just be a couple good things happening in a row at work or with family, and a couple good things lead to me just being not able to sleep and really happy, and everything starts clicking, and I'm making friends everywhere. And the other day in the dollar store, I found a ballet teacher for the girls for $7 a lesson, because she's like, I love you, I will give you a wonderful discount. I was like, okay. And she's a gigantic studio in her house, 90 seconds from our house. Like, that kind of stuff happens when I'm a little bit up. And Chris is like, oh geez, what'd you find now? But it's real things. I'm not just making them up. Like, a lot of good things happen when I'm feeling better, and then when I'm depressed, a lot of tough things happen. It's not a magic thing. It's just what happens. And some of it may be that aura or energy or the law of attraction that I some of that I put some faith into, a little bit of just that positive energy versus negative energy, positive thinking versus negative thinking. Some of it gets a little too far with some of the law of attraction stuff. But when I wake up feeling good, a lot more good things happen. When I wake up feeling really depressed, a lot of hard things happen. Normal days, it's kind of like everybody's normal day. When I'm stable, it's, hey, I have to get myself out of bed. I got to have a good day. I'm going to think positive. I'm going to have some tea or coffee. I'm going to look at the sunrise, whatever. But on the days I just wake up good with no reason, I feel great today, or I feel awful today. Those are the days that really tend to have even more negative repercussions or more positive connections and things happening.
Very difficult situation to manage, but many do. Tell me about your strategies.
Yes, let me pull, and sorry if I'm reading a bit. I just wanted to
go ahead.
Pull them up. So first one I have is just accepting that your brain is not functioning normally now, and that there really may not be a cure. Accepting that you have bipolar. You are not, we all hate the word normal, and you put normal in quotes. There's no normal on a washing machine, whatever. But you have a disorder. Your brain is not functioning as it should. Whether that's normal or not, it's not functioning properly. It's not healthy. And whether, again, that be due to inflammation, chemical imbalance, genetics. A lot of people see the pathways that are formed in the brain from abuse or trauma. whether it's childhood or college. So, trauma has also had a lot to do with my bipolar symptoms. But just knowing there's hope for fulfillment again, there's hope for purpose in life again. So accepting, but remembering to hold on to the hope that you can have a fulfilled life even while you're dealing with these symptoms and trying to work towards that stability. So that's number one. Any questions? Oh, I can do quick questions on each one.
No. Go ahead. Go ahead. I want to
Okay.
hear I don't want to. I want to hear the list.
Okay. Professional care. So one is a good therapist. So somebody that you connect with, and that might take a few times. I had a friend that has bipolar that she's only seen 2 therapists her whole life in the last 20 years. And I'm like, wow, that's amazing, because that's not the typical. I had gone through probably over 15 therapists before I found someone that I've seen since 2009. He's been retired for 5 years, but still talks to me. I
Some
won't
people
say his
spend
name.
more time choosing someone to do their hair than they do their doctors. I guess somehow we're intimidated by the notion that we're going to judge this medical professional, but we have to, right? And if that means shopping
You have to have a
around.
good rapport. You have to have both for your therapist and your doctor. You have to have that rapport that you feel like you trust them and that they trust you. And you have to be honest with them. That's part of this professional care too, is honesty. Don't just say you're feeling fine when you're not. Don't hide the symptoms or the side effects of medication. If you're having them, please, try to be aware. I've had blurry vision. I've had tremors in my hands. I've had paralyzing anxiety. I went blind for a week after my first manic episode, and they don't know if it was some of the medicine or just the mania exhaustion. So they still don't know. But you have to be honest with what you're feeling. And if somebody's responding that my first psychiatrist, I had to leave school for a severe manic episode.
Mm-hmm.
I was I went blind. That's when I crashed. For a whole week. I was extremely depressed from there on out. I was sleeping 20 hours a day. I was on a medication. I won't necessarily mention the name of the medication, but I gained 40 pounds in a month from the medication.
Wow.
And I was sleeping 20 hours a day because like being in my dreams was much better than knowing I had to leave school and everyone thought I was crazy and all these other things. So
well, finding the right counselor is absolutely sure. Give me some of the other strategies.
Yep. And still with professional care, I just still have looped in. A lot of us have pain, like even some of the medications for depression will talk about pain, physical pain that happens. So a lot of us have emotional pain, trauma, anxiety that tie into the different knots and muscles in our body. So as part of professional care, I've seen a musculoskeletal specialist or an MFR, myofascial release therapist. And some of my biggest breakthroughs in therapy have happened during a physical therapy session with those muscle or myofascial release workers. So I always try to let people know if they're dealing with physical pain, there can be a lot of muscle memory, and massage therapists will even talk about that. When they get into a certain knot, someone will start crying and saying, oh, that reminds me of this trauma that affected me. So as part of professional care, I really do like to mention that piece of physical pain. And when you're dealing with that, making sure
that's a great tip. Yeah, that's a great tip. We're speaking with Laura Riordan. She is suffering from bipolar disorder. She's the facilitator, the vice president of the Delaware County, Pennsylvania chapter of the DBSA. That's the Depression Bipolar Support Alliance. And she's taking us through what you can gain in addition to whatever you're doing with your meds and with your therapy to manage this disease, what you can gain in terms of coping skills and knowledge by support groups. We're running out of a little bit of time here. I don't want to keep you much longer. If I just wanted you to
the remaining few, I can do them fast.
Sure, go ahead. I do want you to mention your writing too before we go.
Yeah.
But
thank you so much. Yes.
Yeah.
Third is the support network. So, and again, some of these coping strategies, or many of them, I have learned through my support group. So it's a little bit of a nut within the nut. Is finding a support group. But there's DBSA, NAMI, Hearing Voices is one for some people with depression or bipolar. Are technically schizoaffective, so they hear more voices, and schizophrenia then also ties in. So Hearing Voices is another support group that is more for people who have auditory or even visual hallucinations. But the DBSA group is excellent. There's online support groups. There's a Facebook group with somebody who's in the mental health community, who's a speaker. He's awesome. Gabe Howard is his name, but he does the positive depression and bipolar happy place. So he keeps it as positive as he can, but you talk about what's going on in your life. And then people try to, instead of venting and just bitching about bipolar, it's what are some positive strategies. So there's that support network in any way. And some of my friends for the last 20 years have been through DBSA that we text every day. Educating yourself so you can be self-aware, like you just mentioned, of your triggers. What coping strategies do I have to use right now? There are some great resources out there. Kay Jamison's books. Julie Fast is excellent. She has Loving Someone with Bipolar, Get It Done When You're Depressed, Managing Bipolar. So she has some really, really great books. OC87 is a group that I wrote for, but that's a local. OC87 Recovery Diaries has personal essays and stories about recovering. And another friend has the Better Because Collective, it's called. So it's a nonprofit. I wrote for them as well. But it's how do you, what have we gained and what have we learned from the suffering? And why are we better because of the challenges that have been placed in our life? But those are some good ways to educate yourself, is to read other people's stories and just really think about your own triggers. Next, your overall health and making self-care a priority. So, nutritious foods, fruits, vegetables, proteins, whole foods, not crap. So that's a big thing. Exercise, making sure you're moving, walking, yoga, kickboxing, getting out in the woods. 20 minutes a day can be huge. So even if you're dealing with pain, what's something little that you can do for that? Do you spend time in nature and reconnecting with some sense of wonder and awe of what's around you? And then letting go of any guilt or resentment, because a lot of us have guilt when you have bipolar 1. You do these things that you don't even remember what you did. So there's often blackouts with bipolar 1 because you've slept so little. I have a friend, dealing right now with many, many, many things that she did and hurt people that she never would have hurt while in a manic episode, while also trying to get treatment in another state. I won't even talk about it, but they didn't have a bed for her. So she was in multiple times trying to get a bed, released again, in again, trying to get help and not getting the help, like while actively trying to get help. And they didn't have it. And then these additional, things occurred. So it's really tough. And then evaluating your current relationships is part of that health and self-care too. If you're in toxic relationships or don't have your boundaries set up with family or friends that can impact you, you have to have healthy relationships around you. And then next one, outside of self-care and overall health, sleep hygiene. So a lot of people with bipolar don't want to deal with that. I know how important it is. You got to put your phone down. You got to turn the TV off. You got to disconnect. Maybe you meditate before you go to sleep, or you listen to a calming song. You have to have lights turned out. You shouldn't have the TV on all night. There's different things like melatonin or magnesium oil, magnesium baths, white noise. So there's a lot of ways around sleep hygiene. I could talk about that just for an hour.
Yeah, sleep is very critical in managing this, isn't it?
Yes. And then one other piece is, I think this is 7th, practice meditation and mindfulness, how important it is to be in the moment, whether you're manic, depressed, hypomanic, or stable, being in the moment and just remembering that it's not, you don't have to worry about tomorrow or 5 months from now or 5 years from now or what happened 2 years ago when you were manic or depressed, or it's being in the moment right now, knowing you're alive, you're not in hell, you're physically here, sitting here, doing whatever you're trying to do, no matter if you feel up or down or stable, and just kind of being in that moment. So I have some great meditations and mindfulness practices I do. I like guided meditations a lot because my mind tends to float when it's quiet meditation, but I've done it sometimes. And then some of the head to toe for like bedtime, it goes through relaxing head to toe, each muscle group. So your head, your nose, your cheeks, your neck. So those can be really good. And then the final one is kind of what we were talking about, like, why would I ever do this? The ups and downs are too much. It's finding yourself again and your purpose. And it's that last step, because there's so much work to even feel like you can get to that place. But remembering what you love to do, when you're depressed, you feel like you don't want to do anything and you're so frustrated that you'll never get that back again, never get that joy back again, or that interest in painting or horseback riding or yoga or whatever the case may be, that you'll never even want to do any of those things again. But there is hope for doing that again. So those are some of the 8 steps. Well, and everybody has their own steps, but those are my core 8 things that have some subcategories under them. But those are the things I really know I have to focus on for my health and stability.
Well, we thank you so much for your time, and we obviously there's a lot to know about this, and managing it is critical because, as we said at the beginning, this is something that's like, as you sit here now, it's going to be a lifelong condition. So it's not about curing bipolar and depression; it's about managing your life. Laura Riordan, she's living proof that it can be done. She's doing it now. And if you want more information about anything you've heard from Laura, you can visit the site. We'll have a link to the site. Laura, you've just been published. What's the name of the writing group that's dedicated to these topics?
Yep, OC87 Recovery Diaries. It's based in Philadelphia. I actually got to attend a women's writers retreat connected with them. That was absolutely wonderful, that we really delved into some writing around mental health and recovery, as well as the struggles and traumas and triggers and history. So there was some really amazing topics we focused on during that retreat. But it's just OC87 Recovery Diaries. You can Google that. I also have my own blog, the tamingthebipolarbeast.com.
Yeah, that's, by the way, it's a nice looking site. I was looking at it earlier. Yeah, we're going to have links to all of these things so people can get more information.
And then just my one other main one I've written as an article was my friends at betterbecausecollective.org. So that one, I wrote an article about kintsukuroi, which is the Japanese art of repairing a piece of pottery or something that's broken in the cracks with gold or silver to make it more beautiful in the brokenness, making it more beautiful again.
Huh.
So I took that as a metaphor. The word kept coming up, and I said, Rebecca, I need to write about this. And she said, I think it's an awesome topic. I want to publish that. And I got to work with a great group of editors from her site to put that story together. So it's a metaphor for the trauma and the abuse and the challenges that we face. Illnesses, cancer that comes up, diabetes, mental health issues. We all have something, a death of a parent, or a sibling. So we all have that. But how do we make it more beautiful with all the challenges we face? And I used a metaphor of kintsukuroi to tie that together. So I was proud of that piece.
Well, good for you. I think it's great. Laura Riordan, again, it's DBSA, that's Depression Bipolar Support Alliance, their national group. So if you're listening to this, obviously outside of our area, there's probably a chapter near you. Check it out.
We'll have a zip code search on the national website.
Yeah, it's really
really, and then locally we're dbsadelco.org.
Thank you, Laura. Continued success. I know you started a new job recently. Good luck there, and we'll have you back sometime soon, huh?
Thank you so much. Absolutely, it's been a pleasure.
Thank you, guys. Don't forget to like us, follow us, subscribe to the Behavioral Corner. We'll catch you next time. Bye-bye.
Thank you so much.
Retreat Behavioral Health has proudly been serving the community for over 10 years. Here at Retreat, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 or visit us at www.retreatbehavioralhealth.com to begin your journey today.
That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.